we mentioned earlier, we'll be talking about knee pain, which is a common problem with many causes, and from acute injuries to complications of medical conditions. Knee pain is actually often accompanied by physical restriction. Now, the treatment of knee pain depends on the underlying cause. Knee pain can be localized to a specific area of the knee or be diffused throughout the knee. In order to discuss this issue further, we are very much delighted to be having with us here Dr. Mahmoud Hafez. He is an inventor and professor and head of the orthopedic unit at the 6th of October University. Good to have you with us, Doctor.
Hi.
Well, welcome, Doctor. Well, you joined the 44th International Exhibition of Inventors or Inventions in Geneva, and you won a Golden Award for your invention. So would you tell us more about your knee invention, please?
Okay. Basically, I'm using computer-assisted techniques, which is a top technology right now in surgery to treat bone and joint disorders in man, in human, and also in animals. And the same techniques can be applied to the industry.
And what are the strategies and techniques used in your invention?
Okay, we use not only medical and surgical techniques, but actually we're using computer science and engineering. Not only one discipline in engineering, but more than one discipline, like mechanical engineering, electrical engineering, even civil engineering, which is very related to bone and joint and to the skeleton. And all these strategies used together in order to achieve what's called computer-assisted techniques to do the surgery.
So, Doctor, it's more into the diagnosis rather than the surgery itself?
No, it is
or
the surgery itself.
Surgery?
It's actually, we do the planning of surgery. So we do the operation on the computer before it is done on patients. The computer-assisted techniques, as an examples of it, we have robotics, we have navigation system, you know, like a car navigation. So we have a navigation system inside the operating room where we can use like a local positioning system, similar to the GPS, global positioning system. That's a local with a camera, and it is more or less the same like car navigation. These are two most common or popular techniques that's used for computer-assisted surgery. The technique I'm using is a third modality, and it is much cheaper and easier and suitable for our community, where we don't have to buy very expensive robotics or navigation system, which are also complex, not easy to learn, very difficult to the maintenance and everything. So for our technique is only software, where we do a CT scan for the patient. For example, the most common procedure is a knee replacement, joint replacement, artificial one for the knee joint, where we do a CT scan of the patient, we import it into the software, and then we have the joint replacement itself also on the software as a CAT file, 3D file, and then we can plan the whole surgery, measure the size of the joint, and make the axis of the joint, and do the whole surgery, do the bone cuts, and position the implant so that the patient can see how the joint replacement look like, and also the surgeon can view this and approve the planning. And then at the end we develop two templates or two pieces of an instruments which transfer the whole planning into the operating room. So in this case, the surgeon uses these two pieces after sterilization with the autoclave and use them to do the surgery instead of about 400 different pieces with a conventional technique. Okay. So in order to do a knee replacement conventionally, you have to use all these large number of instruments on a very, very big table inside the operating room, and they have to be sterilized. And one of the things we use also for conventional technique is we have to drill the bone. We use like a chenure. We use drilling inside the medullary canal, and this causes a lot of bleeding, something called fat embolism, which could be fatal. And that's why surgeons here cannot do the two knees at the same time for fear of complication. But using our technique, we don't have to use the drilling, we don't have to use this machining, and the blood transfusion will not be necessary. complications less, time is less, and many advantages.
What type of patients, Dr. Hafez, would benefit the most from this invention?
Especially elderly people who are going for joint replacement. However, our techniques now is applicable to more than one procedure or one surgery.
Now, I'm quite curious. You mentioned that you won't be doing much drilling
Yes.
and not as much interventions. Now, then how, if you're going to replace the kneecap or the joint, how would that take place if you're not doing any incisions?
Because we
in
did
it?
most of the work on the computer.
Yes, but I mean in the operation room.
Yes, we do the cuts, but through the template. I mean, actually, I have a small model here
Yes.
to explain the technique that we use. So the whole planning done for an operation, which is a half joint replacement of the knee. This is a complex procedure. Not many surgeons trained to do it, but we make the surgery easier. So rather than using complex instrumentation, we do the planning. The whole planning is transferred into that small piece, which is printed with 3D printers, and then this is specific for the patient. So the patient name is written on it, and then you position it in the bone on a specific position, which you carry the whole planning, and then you can make the cuts. We usually use soap to make the cuts on the bone through these slits and holes, and then once it is done, that's it. Then this is the whole operation. Then the bone is ready to implant the joint on it.
Okay.
So it's minimum intervention.
Minimal intervention, yes. Minimally invasive surgery, we call it.
Okay. Dr. Hafez, the participants applied to enter the exhibition through the website of the Academy of Scientific Research and Technology, and the applicants were then selected and sent to the exhibition, and the expenses for the entry into the exhibition, the travel and accommodation were all covered by the Egyptian government. How do you see this kind of support by the Egyptian government?
Yeah, this is great actually, because it is very good, especially for young inventors. We have some young people who are just in secondary school, and this is really great for them and also for everybody. Being a representative for Egypt, it is a responsibility for me, and this is a great help from the Academy of Scientific Research. And to be honest with you, I've been here in the country now for about 9 years, after 17 years being away, working in US, Canada, and UK. And I have been representing Egypt in all conferences. I go for about from 5 to 10 international conferences a year, and I have been representing
That's almost a conference every month.
Almost, yes. And I do this personally, without any support. But you know, when you get support like this, even psychologically, is more important than the money itself.
Now, Doctor, actually it was quite a competition, because there were like 695 exhibitors from 40 countries. Now, which were the most challenging inventions that when you looked at, you were like, oh my God, what about mine? And you were worried?
Right. Actually, in my field, there were no like competitors. There are competitors in bone and joint with other inventions, but nothing was similar to mine. But what is unique there is that you see countries with huge number of inventions. You know, like China. You know, these countries were developing countries. Several years ago. And we wish that Egypt will be the same, because we really, in Egypt here, we have people who are really creative. They just need to learn the basics, and also some about how to file a patent and things like this, which is very important and challenging.
Okay. Dr. Egyptian inventors won 11 medals at the 44th International Exhibition of Inventions as an Egyptian. How do you see this?
Yeah, I think
we've been talking about scientific research and the problems facing science, and
it was good actually for the Academy to support this large number of people, and many of them, actually there were so many people who applied, I think, and they selected the most competent or the most the better inventions that could that could win the prizes, and that happened. So
what about the inventions that attracted your attention, whether Egyptian or foreign?
Yes, that's actually there were many, not necessarily in medical field, okay, but there were other things in different disciplines. They could be some very simple ones. For example, they were like 3D printers machine that they can print food and clothes, things like that, which is the 3D printers is now going to be the technology for the future. You know, like having a printer at home with your computer. I think in future everybody will be having 3D printers that they can print any shape on the computer. They print clothes, they print food, they print everything through these 3D printers.
Okay. Dr. Hafez, it's great to have all these Egyptian participants in the exhibition, to have young Egyptian inventors, but still the problem remains, in my own opinion, because I have kids at school and I believe that kids, or many Egyptian kids, take science as a subject to pass the exams. They are not really into science. They don't have this passion, you know, for science and invention. And I don't know why, what's the reason for that, but I think we need to look into the reasons to encourage young kids to be more into science, into creativity, into innovation. How do you see this?
Yeah, I think it is the same also in medicine, in my discipline, that people are studying medicine like for 6 years and they just feel like it is a dry science. But it is the most important is just to engage students into the practice. What I have seen when I was practicing in Canada, US and UK, that students in a medical school from year 1, they go to hospitals. But here when I started medicine, I didn't go to the hospital until I'm graduated, or you know, like the last few years before graduation, and that's even just only to watch, you know, or to, but not really to participate in practice.
How do you find the scientific research in Egypt so far?
Horrible.
Why?
It is at the bottom list of priorities. Not only for government, not only for institutes, but even for people. Because, you know, I failed to get young doctors to be engaged in research. And I decided at the end to have a team of researchers from different disciplines. So in my team I have 3 engineers, I have biologists, I have dentists, and I have researchers. And but for doctors, for example, to be engaged in scientific research, and the doctor's salary and the government is less than £500. So how he can find time for research? He has to work hard in order to make money, in order to live.
But sir, now you're touching upon a very important issue that perhaps touches upon all our lives and affects our lives in many aspects. So in your own opinion, since you've been living outside Egypt in countries like the United States, like Canada, how can we work on communicating the science to the public, the importance of science to the public? As you mentioned, it's not only the role of the government or the institutes, but the people themselves. They need to be aware on the importance of that.
There are very simple ways, for example, just to raise awareness. For example, in Egypt, there are how many TV channels? There are so many. There are more than the TV channels in UK. Definitely there are many more than what I have seen in UK. So all these channels, the time is wasted really by having so many programs which are not useful. Some of them are harmful. So why not to raise the awareness, have many programs? Some of them should be interesting, and just invite people who are, you know, like what you did right now. You know. So you invite other colleagues and other inventors. There are many inventors who did not go to Geneva, and they are much better than me and the others who attended.
Now, doctor, how long did it take you working on your particular invention?
2001. So it is about 15 years.
Wow. Oh wow, that's a
yes,
lot.
but I ended up with 5 patents. My technique is used in animals. We did the first dog joint replacement in the world with our technique, computer-assisted surgery, where we did the implant itself, the prosthesis itself, is also manufactured totally in Egypt here. We also used our technique for total knee replacement. We used it for unicompartmental knee replacement, which is a half joint in the knee, which is a very complex procedure. We used it for hip replacement. We used it for spine, for Mahmoud Hafez, for the, the spinal operations.
Yeah.
We use it also for deformities, people who were born with congenital abnormalities and deformities. Recently, we did, yesterday only, the first shoulder replacement using computer-assisted technique.
Oh, wow.
And I can say, yes, I can say that this is the first outside Europe and America, and North America.
So it's in Egypt.
It's in Egypt.
Oh, that's
Nobody
great.
knows about what we do.
Unfortunately.
Honestly, we did many procedures. A few days ago, we operated on a patient from Switzerland who came to our hospital, to October 6 University. And it is not a 5 stars, like accommodation, like some of the private hospitals. But she came, she trusted us, and she was referred by another patient who came from Luxembourg. Just only 2 months ago, we did bilateral total hip replacement for her. It was a complex procedure. And the patient from Switzerland, she had 5 failed surgery on her hip, and we operated on her. And nobody knows about what we do. We have a very good chance that we could do medical tourism, that we can also treat many people here, even the poor who cannot afford, because our technique is cheap. We can do bilateral knee replacement on the same setting, and this can save a lot of money. We did a study on cost effectiveness, and we found that we can save about 26 million Egyptian pounds for the Ministry of Health for every 1,000 case.
Does anyone know about these initiatives? I mean, did you try to communicate somehow with the Ministry of Health?
To tell you the truth, nobody is going to make a change, because making a change is the most difficult thing, most challenging, and it could challenge any responsible person, and he can lose his post.
What you're saying is very important. It's critical. I mean, it's not only about going to exhibitions and winning medals.
Absolutely.
Or just making inventions.
Absolutely.
It's about taking this as to the next step, to the next level.
Correct.
People need to know about this. There has to be some kind of support, awareness, as you mentioned, in this regard.
Actually, I don't need support. All what I need to help the country. Nobody is allowing me to help the country.
So what do you really need, doctor? Like, what do you really need?
What I need is not money, is not funding, is not media. Okay.
All right.
I had enough media. Okay. But actually, somebody brave who can just look at what we do. Okay. Only make a decision. For example, the operations joint replacement is done in small hospitals. They get complications. They cost the country a lot of money. Okay, and just only by using our computer-assisted techniques, you can guarantee less complications, good outcome, saving money, and that's all what we need.
So you'd like it to be implemented in the public sector hospitals, for instance?
Yes, absolutely, because I can save them money.
Okay.
Although it can be applied in private hospitals and you can do medical tourism. But actually, I'm academic, so my work is mainly in university hospital, not focused at all on private hospitals. But if the Ministry of Health wanted to have this tool as a medical tourist, it can earn a lot of money.
Okay. Doctor, for any researcher or inventor, where he reaches is just a step to move on or to move forward. So with all the patents that you got, with the invention that you have now, what would be your next step? Where would you like to go next?
Outside Egypt. What I mean, not for me to leave Egypt, but that my technique is now applied outside the country. In some of the Gulf countries, some of the African countries like Nigeria. We're moving to Indonesia and Bangladesh, into the countries which have got huge population, and also they have very complex cases, because my technique is used for complex cases and used where conventional techniques cannot work. So in these countries, they have either they have high funding and they look for a top technology, or countries which they have complex cases and they don't have enough funding, and our technique is cost effective, so they can benefit. And that's what this is my next step, and we're working on this.
Okay, Dr. Mahmoud Hafez, Professor of Orthopedics and inventor. Thank you very much for coming.
You're welcome.
Now, congratulations again for the invention that
Thank
you
you.
made, and I really hope that people watching us would pay attention. We shed light. We did our part, shedding light on this very important issue. Thank you very much for
Thank
doing
you.
that.
Thanks.
So thank you, doctor. And now it's time to enjoy our cruise online, showing you the latest trends on the social media. So we'll be back.